Thanks, Ollie.
Oh. Hello, everyone. Firstly, I must apologise. I've had a sex change. I'm using my wife's computer, so I'm an alias Jan Matthews today. So apologies for that. But a warm welcome to everyone under these difficult circumstances. And again, thanks to David Caple, our resident guest speaker that's been guest speaking for, I reckon, about 10 years. He's been coming and volunteering his time to help us out as a guest speaker. So to David, thank you very much. I'm going to hand over to Adrian from LinkSafe. Adrian's one of our committee persons, and he's going to work us through the housekeeping rules, etc., today. So thanks to Adrian for helping us out as well. And I hope everyone, if I don't get an opportunity later, but I probably will, but I hope everyone has a great Christmas, and let's hope that 2021 is a little bit better for us. So anyway, this is the best we can do, and thank you for everyone for joining us in this Zoom meeting. So over to you, Adrian.
Perfect. Thanks, Ollie. And it's quite an interesting time. Obviously, we probably should be at Parliament today, eating, steaks and fish and having some merry drinks. But unfortunately, times are a bit different at the moment, and we're making do with what we can. So, firstly, thank you to all of you for attending today. I think it's a really good turnout for obviously an online version of our CSG group. So just a few housekeeping rules for today. So just remain on mute during the presentation. If you do have questions, we'll obviously get to them, but remain on mute during the presentation. If you have any questions during the presentation, please write them down in the chat section, prefacing your question with the letter Q. And that the chat button is at the bottom of your screen in the middle. If you'd like to ask a question after the main presentation, so the presentation, we've told David he's going to be talking for 3 hours, but it won't actually be. He'll talk for about 20 to 25 minutes. And so if you've got any questions and you'd like to ask them at the end, feel free to wait to the end if you like, and you can write your name in the chat section, prefaced by the letter Q, and David or one of us will call upon you in order as well. I'd like to introduce David Caple. He's obviously a very close friend of the CSG group, and lots of us here today have heard David talk before, and we love to hear him talk as well. So we're really lucky to have David with us today. Again, obviously in different circumstances, normally we're having that Christmas lunch, but obviously this is another great opportunity to hear David talk. So David is going to round off this year with his annual address, and it's always a very popular address. So we're very fortunate to have him. So look, Professor David AM has been leading figure in occupational health and safety here and overseas for many years. He has advised a wide range of businesses, industry groups, and public sector organisations, and has worked with Australian and overseas governments on work, health and safety strategy. He's currently an OHS consultant and Adjunct Professor, Centre for Ergonomics and Human Factors at La Trobe University. Without further ado, David.
Thank you, Adrian, and hello to everybody. It's great to be part of the Central Safety Group session again this year. And let's see how we go with this Zoom thing. Actually, Adrian, when you're talking about my overseas involvement, I'll just share with you a little anecdote. On the weekend, we were camping up at the Grampians, and I'm on a various conference scientific committees, and we had a meeting with the UK conference on Friday night, and it started at 9 o'clock our time, and there was no signal where I was, so I drove into Halls Gap, and I got a signal in the town in the park, and by 9 o'clock it was starting to get dark, and the only place I could stand and be seen was in front of a light at a gazebo sort of thing. And then I got surrounded by about 20 kangaroos who were just eating the grass in the park around me. And so I kept sharing my Zoom with these kangaroos. Well, the people in England, I don't know what they think, but anyway, it was quite an interesting, thing from being part of this community. But as Alan said, today I just want to reflect on 2020 and the COVID-19 experience. It's something we've all shared. It's something that in our respective roles as health and safety professionals, we're probably all being called on to be involved in some way and another. I've just picked two industry sectors that I thought I'd talk about, but I'm really interested to hear what you say and in your involvements as well. So feel free to share your work experiences. The two industries I thought I'd talk about is basically those who are going back to offices, and secondly, the healthcare sector, who's done such a fantastic job in Victoria, well, in Australia, to address the cases in very difficult circumstances of not really knowing what the rules are. And I think just as an anecdote in that space, one of the hospitals I was involved with, they had a group who were monitoring the advice from DHHS on safe procedures in the hospital. And I think it was about early August, I checked, and they were up to version 24 of their PPE advice. And when I visited one of the hospitals, they were still using version 10. And it made us realise that this was such a rapidly changing body of knowledge that communication and change management in itself was probably one of the biggest problems in industries, to be able to ensure that they were keeping up to date, but also that their staff were well aware of what their positions were. So I'll just share with you my screen and we'll just have a quick look at this presentation. And the objective is just to have a look at the implications for workplace safety. So the first one, I suppose, we've all been working from home for many months now. And the first point I just have to make is that typically offices are only occupied about 60 to 70% of their staff. Anyway, so a lot of the surveys that when people are about to relocate, because 30 to 40% of people are not at their desk. They're on holidays, they're on sick leave, they've gone to a conference, they're out of the building at a client's meeting or something. So it's sort of interesting also in Perth and Brisbane, the companies I'm involved with, they're currently running around 20 to 30% occupancy, even though the staff are allowed to come back to work. People are choosing not to come back to work for a whole range of reasons, which we can talk about. So my prediction is that probably 50% is as good as it's going to get, which is what the government is saying in January. Private sector organisations can maybe move towards. So I just put in this presentation, there's a lot of links, so don't write them all down. I'll give the presentation across to Marina and she can upload it so you can have a look at them later. But these return to work COVID safe plans are mandated, as we all know. And we've done an audit of a couple of these, and I just want to reflect on some of the practical problems in implementing them. So if we have a look at priority of people coming back to work, the first one is fairly self-evident. I think we've read enough about this in the papers to be aware that these people in that type of situation need to be able to have a choice. The second one I'm finding more and more coming, where people have psychologically had that separation of that's what I do at work, this is what I do at home. And when they're doing work from home, if they're dealing with very challenging matters, there is no time in the car or in the tram or just to walk to say, okay, I'll leave that at work because I'm now at home. And I think this is one of the reasons why people want to get out of home, is just to be able to have that separation. The third one relates to just the logistics of working from home. And I've had a number of examples where people are in shared accommodation, and so the only thing that they've got which is private is their bedroom. So they're in their bedroom, in effect, 24 hours a day, either sleeping or working. And bedrooms are not necessarily big or conducive to having an ergonomically suitable workstation. So they're really in difficult circumstances there. Distraction from dogs, children. I think we've all probably been on Zooms this year and we've had the cat walk across the screen and the child run in and pull the camera off the computer, and all those sort of things happen. And, you know, whilst that's life, some people say, look, it's too stressful. I'm just feeling anxious all the time and I just want to have an option for that. The other thing is new starters. I've had a friend who started a new job during COVID and resigned during COVID. Because she just found it too hard. She never met her colleagues. She never was sure of what her KPIs were and what she was able to do from home. So those people that need supervision support, I think need to have the choice. And the last one is just for collaboration and innovation work. It's really hard to do that over the medium that we're doing at the moment. So a lot of the new offices have got these big whiteboards and innovation spaces, and I think those people would be the ones who go back. But having said all of that, I still think about half of us will stay working from home. So we'll probably end up with a hybrid model, some days at home, some days at the office, and therefore we need to think about ergonomics in both these environments. In terms of the policy of who pays for what and where do you get it from, I'll show you in a sec a summary of a survey that we've been involved with of a lot of companies to say, how do you accommodate people working from home with their computers, their furniture, and just the running costs of, in effect, running an office from home. And then the flip side is when people have their days back in the office, what's the policy about shared workstations? And if we do that, what's the policies about things like technology, the keyboard, the mouse, and things of that nature? So I'm sure we've all got an opinion and maybe some experiences we could share later about this. But I don't expect you to read this, but you'll see there's lots of ticks and crosses. So across the horizontal axis at the top, A, B, C, D, etc., are different companies that were asked to provide a response to what are they providing to staff working from home. And on the left-hand monitor, chair, headset. And you'll see that there's a real mixture there. I suppose a couple of companies have said staff basically pilfered their desk and took home whatever they could and have set themselves up with their own work equipment, where others have said, look, you can buy, we'll pay for a separate monitor, keyboard and mouse at home. And so there's some inconsistency here about policy of, if we do expect the duty of care of having a safe workplace at home, then who pays and what is it that we expect people to have if they're going to routinely work 2 or 3 days a week, for example, from home. The next line down is, sorry, it's just interesting about chairs, for example. About half the companies are providing an ergonomic style chair for their staff to work from home. In the short term, they've just said, look, we'll organise for you to take the one from your own office because we won't be needing so many chairs when everybody starts the hybrid model to come back. Or alternatively, they've said, this is the company we buy our chairs from, we get a best price, you can buy one too, you can pay for it as a tax deduction, as a home office expense for yourself, and it's yours forever. Or we'll give you a certain amount of money. And so one of these companies gave their staff $300 and said, you go and buy a chair or a footrest or whatever you need for your home office. So that is varying a lot. If you can read the screen, there's a lot of companies providing a one-off cost, and that ranges somewhere between $100 to $500, and others are paying a recurrent cost of $50 to $60 a month typically, and the staff can use that in whatever way they wish. The interesting, I suppose, from our perspective is that the bottom column, bottom row, everybody's providing an online self-assessment for home office work. And the majority of these are providing an online virtual ergonomic assessment from their either internal or external persons if required. So I suppose that was reassuring to think that most organisations are providing training and support for staff, but the variability is in the toys and tools of what people have provided for them to work with. There's a little app that Alan Hedge, and I think many in Victoria know Alan because he's been here many times from the US, and he's got this home ergonomics training app. So if you download it and have a look at it, there's a lot of nice little tips in there of how to improvise in the home without going to a lot of expense. I mean, just interestingly, I find in talking to you at the moment, my laptop, which has got the best camera of my computer, is sitting up on a big tissue box, and it actually works really well for me. And I can, Marina, you've got yours too. And so I don't want a monitor arm on my desk at home. This does fine. When I finish this, I'll take the tissue box away. It then becomes a laptop I can use on the table. There's a lot of this improvising going on, and I think that's healthy. People don't want their home to look like an office. And as long as the ergonomic principles are being met, use your imagination and see how best it can be done. WorkSafe has guidance on working from home as well on their website, and it's always good to go back and have a check what they're saying. This is just a few basic dimensions that people say, well, what do I need at home? And I've just taken these out of the Australian standard on workstations, but the principles are pretty evident. The table or chair, the table or the desk around the 720s, 740 millimetres high, 90% of the population can work quite safely with that. The higher workstations just need a footrest or a box to put their feet on, and that tends to work quite well. The minimum of 700 deep is if we've brought home the LCD monitor, and if we're using multiple monitors, and I know a lot of people are doing that nowadays, then the 800 millimetre does work better for the eyes and the neck. The workstation length, 1200, tends to work okay for a single person, or 1600 if there's a lot of paperwork involved. But it's often the leg space which is full of clutter and cables that, you know, be interesting if you wanted to later to share some photos of your own home offices together and just show how you've set them up and improvised. But they're the basic principles. These are just some of the confounding factors about we're finding people are anxious about. The main one, I suppose, public transport. And I know we all have to wear masks on public transport, which is fine. Shared communal areas, and the third one about contractors and visitors. What we've found in the COVID safe plans is that a lot of people are focused on their workstation meeting areas, but these kitchens and places where people congregate is probably where the COVID plan has been falling down. And particularly where contractors come in to change the light bulbs or to weed the garden or whatever they're there on site for, they'll often come into the kitchen and they'll get a cup of tea or they'll go to the toilet, and they may not have been inducted in the same way as the staff. Contact tracing, we just talked before the session about the QR codes. I think, Adrian, you can put in a plug for link afterwards if you like about that. But that seems to be the way everybody is moving, which is fine. The cleaning programs in the COVID plans I've seen have been I would have to say quite idealistic compared to what I've seen actually take place, particularly where contract cleaners are engaged. They'll often come sort of 6 or 7 in the morning or 10 at night, and yet the COVID plan says you have to have deep clean of high touch spaces during the day. No one seems to be coming back on site to do that. So I think we just have to think about, well, what is it we want the staff to do, and what are we expecting the contract cleaners to do to meet the COVID plan expectations? PPE, I'll come back to that shortly, but I think there's a lot of false hope about PPE and what we think it's doing and what in reality it is doing. But one thing in the workplace is, how do you dispose of it? Do you need to have a contaminated waste type approach, or do you just allow it to go into the normal bins? These sort of things are topical. I think you'll be all aware of the guidance in this space, WorkSafe, DHHS. I've just put another one in there from the UK. The health and safety professionals over there have been very active, I think much more active than we are here in public health. So they've been involved in the design of ventilators and the modification of factories who used to not make them to now make them for hospitals, and a lot of the protocols involved in public health spaces. So we're proposing to invite Peter Buckle, who's from the Imperial College in London, to run an online one of these in the first quarter of next year. So I'll send the details to Marina, and you're welcome to join that at the time. So the second theme I had was about hospitals. And one of the first questions is, do you bring patients there, or do you take the healthcare to the home? A lot of the marquees in the car decided it was safer to leave them residents there and take the care to them. But for those that go to the hospitals, most of the hospitals that had COVID patients had green, amber, red zones. So green was where people arrive, they do their QR testing, they get their PPE, they get themselves ready. The amber zone is where you change into the clothing or change out of the clothing when you leave the red zone. The red zone is where the COVID patients and the high risk areas are. And I'll just make an observation that most of the people in the red zone were volunteers. These were doctors and nurses and support staff who said, I'm okay, I feel I've been adequately trained and I'm prepared to do my bit. But the next point about, even though hotel accommodation was offered to most of these red zone frontline staff, a lot of them didn't use it. They'd go home because they just felt they couldn't relax. And so this common description of being emotionally, physically and psychologically exhausted just started to emerge in this last second wave from the healthcare workers. And I think that's perfectly understandable. But I think what it does mean is that, God forbid we have a third wave, will these same families and professionals be happy to volunteer again to put themselves through what they've done for our community so far this year? So I think that's a risk that we just need to be conscious of. It's not just the infection control, it's actually the emotional and psychological load that they feel they're carrying for their family and themselves. And the last point here is that we need a pandemic coordinator at all workplaces, I would say, because I've found a lot of people in their COVID plan have said, oh, well, that's being run by HR or by the OHS team. But in reality, controlling this in a large workplace is quite complex, and you need someone who is making the call. So I think if you don't have a pandemic coordinator or someone of that nature, when things happen quickly, it can get quite out of control quickly. In the hospitals, these were the elements that we identified needed to have a governance in place. So the infection control is self-evident. In terms of, in that example at the start, these versions change very quickly, version of our governance on infection control. The PPE supply and suitability has been all over the newspapers. And to be frank, as far as I'm aware, it still is a problem in this area, because there are some, and I'm thinking particularly of masks and gloves, and the coveralls. There are some companies that actually have better quality products than others, and without trying to be too inflammatory, our dear president over the Pacific Ocean decided that 3M should prioritise product for the USA. And so they were just not available here in Australia. And so a number of companies have been importing from China directly to try and keep the supply up. And the other thing is the sizes, and I'll come back to this, but some of them that have been imported that have 80% of medium and hardly any small and hardly any large. So it's not just the number, it's actually the suitability for the anthropometry and the application. And I'll talk in a bit about the testing of it, which has also been all over the papers. The site facilities, heating, ventilation and air conditioning has been in the news a lot with COVID. In the earlier days, it was thought that transmission was by droplet, and then it was discovered that aerosol was also a primary source of transmission. And so there's been a lot of heart searching about totally enclosed buildings where you can't open the windows, and how many different circuits of heating and air ventilation is there, and if you want to block one off, can you do so? That's still a work in progress, and DHHS have produced an audit tool for workplaces to use to check their systems. And if it's a part of your role, I think you should have a look at that. In terms of environmental services, I'll just mention about the linen and the waste handling. Often this is contracted out in large hospitals, and their systems are totally dependent on how it works within the hospital through that supply chain, and do they follow the same standards of cleanliness and control. Catering is a big issue. At one of the hospitals, their chicken supplier had to shut down for 2 weeks because they had an outbreak of COVID amongst their staff. And suddenly this catering department had to find a whole new source of chickens. You know, things like that can throw your COVID plan completely out the window if you don't have contingencies for the fundamentals of food, cleaning materials, linen, and so forth. The response team for the hospital and off-site facilities and the monitoring of their staff and wellbeing, in one of the bigger hospital groups, they had, I think, about 20 nurses tested positive to COVID. About half that group were actually community transmitted cases, but they all needed to be on work cover, they needed to have support, their families needed support. And so it was quite a challenge for the work cover team to actually work through the physical and the psychological consequences of dealing with staff with, say, COVID positive. The return to work is sort of relating back to that, and the notifications to WorkSafe and DHHS. And finally, the issue of communications. And that issue about version 10 versus 24 really highlighted there was so much information. Their notice boards were just plastered with, oh, this is the new bulletin, this is the update. Staff didn't read it. So they reverted to a start of shift toolbox style meeting to say, these are the things that today are different. And people just reverted to the verbal communication as the sole method of truth. And maybe we need to think that through as to who is it that's giving that truth, and how is it done in multiple sites and different shifts. Just to finish my little bit, I just thought I'd talk a little bit about the masks and the fit testing and fit checking. So the qualitative fit testing, if you just glance down the slide, this is an OSHA protocol, but it's a smell test. And when you've got your mask on, you put the hood on, they inject a smell of either a banana, a sweet taste, or a bitter taste. And if you're wearing your mask and you can smell it, then there's obviously a problem with your fitting of your mask. So that's what they call the qualitative fit testing. The second one is the quantitative fit testing, where they actually test for leakages around the outside of the mask. And if they're detecting a leak, then it means that, again, the mask is not fitting. Our colleagues in the Australian Institute of Occupational Hygiene have put together a RESFIT training program. So if in your workplaces you're looking at masks and their suitability for particular applications, I just encourage you to contact the AIOH and have a look at their training programs and also how they've been supporting this sort of quality testing of workplaces. They've been doing this a lot in hospitals, I'm aware of, but come back in the chat about other workplaces. The option which most people do is fit checking, is saying, I'll stand in front of Adrian and I'll have a look at his mask, he'll tighten it around the back of his head, and we'll just see, can I see any gaps that might be happening there? The immediate thing is Adrian's wouldn't work because he's got facial hair, and there's only very few masks that are suitable for people who wear facial hair. So Ollie, you're out of it too with your moustache. And I think people have some blind faith that the masks protect them, which they actually don't in majority of these cases. If you're interested in the different shapes of the bridges of the noses of different ethnic groups and the shape the mask has to be moulded, there's a guy, Roger Ball, B-A-L-L, who's done a lot of work on facial anthropometry. And when the SARS issues were happening many years ago, I was working with Roger and the World Health Organization to try and bring to the table the importance of facial anthropometry for the designers of masks, particularly across the bridge of the nose is where a lot of the leakage occurs. And I mean, interesting, their response was, oh, look, we're not going to get involved in commercial issues. That's up to the companies to research. We're more involved in the chickens and stopping the communication of the illness, which is fair enough, I suppose, take up the hierarchy of control. But there is a lot of design issues with PPE, and gloves is another one which we could talk about as well. And as I mentioned, with the N95, small sizes in particular have been in short supply, which is why a lot of organisations have been reluctant to do fit testing, because you actually waste a lot of masks in the process of trying to test it. And even if you do find a mask that might fit my face, there's no guarantee that I might tighten the straps next time I put it on to be actually effective anyway. So to finish up, as mentioned, I'm an adjunct professor at Trobe. They're going to run a free year, and you're all invited to register for that. The registrations are now open. And there will be a group of people who will talk about various research projects that have been going on COVID, to just see what's sustaining and what's been dropped. So Jodie Oakman, who you probably all know, she's been conducting a survey on the physical and the psychological impacts of working from home. So she'll be producing the results of that at this seminar in February. And the last one is just to let you know that the enrolments are open for next year. If any of you are wanting to do any professional development in the course on health, safety and ergonomics. Interesting, with the universities all being subjected to severe cuts, this particular course has been supported, and Steve Bracks, who's the new Chancellor at La Trobe University, wants to increase the profile of health and safety training. So that's reassuring to know that it's supported at that level. So I'll just finish there. And in finishing, I just want to pay a tribute to your committee, because I think what you have sustained in 2020 is what a lot of others haven't. Professional development is an important part of all of our lives. And I just want to congratulate you for doing what you do every year. And maybe in your little Zoom room, we can just give everybody a clap and say thank you to the Central Safety Committee for hosting this again this year. So I'll go off now, Adrian, and we can just open up for some general chat and reflections on how COVID has impacted on workplace health and safety for other people.
Thanks so much, David. That was incredible. That was very insightful. We will open up to any questions. Marina, did you have any questions that came through during the chat?
No, there hasn't been. And I'm just trying to work out how to go to gallery view. Here we go. Now we can see everybody. No, so maybe.
Yeah, we'll open up to any questions. Feel free to, because there we go. And especially thanks for delicious plum pudding delivered in November. That was from Mary. Absolutely agreed. So any questions while we've got David? We've still got a little bit of time left. If anyone has any questions for David, it can be certainly about his talk or just personal stuff. That would be fine as well, I'm sure. David, right?
Cameron's got his hand up.
Perfect, Cameron, go ahead.
I started off. I suppose we're battling at our office with a start back in probably the 11th of January. We're doing a bit of a soft start now, so we've got about 10 people out of 60 there. We're battling with the kitchen as well, as you mentioned, David. What we do, we've got quite a large common kitchen with common utensils, common dishes. We've got dishwashers, we've got microwaves, we've got coffee machine, we've got toasters, we've got all that sort of stuff there. And at the moment, we've just sort of stopped it all, just said no use of the kitchen. But obviously, when we start to get people back, we're going to have to look at that a little bit deeper. And I suppose, dishwashers are good at washing dishes, but it's the people that are unpacking it and putting it away that'll be our problem. I don't know whether anyone's got any advice or what they're doing, but we're just tossing up what come January 11th, what we're going to do when we have 30 odd people back, which is going to be a problem. Everyone will want to have a coffee. Everyone won't be bringing their own mug in from home, I guarantee it. And people want lunch. So if anyone's got any suggestions.
I'll just give my sixpence worth. You're quite right, Cameron. I think this is going to be problematic. The jar of coffee is now going to be sachets, or people will go down the street and buy one. The food left in the fridge be thrown out. The couch that everybody used to sit on and read the paper has got tape across it to say you can't sit here because we're not sure how to clean it. I think there'll be quite a change of behaviours in the kitchen. I suppose the good news is that our 4 square metres becomes 2 square metres. That sort of space limitations may reduce. But in terms of the practicalities of what you're talking about, I'm also interested in any other experiences of people that have come back to the office.
I can speak from my experience. It's Mary Tian from Melbourne Water.
Yes, Mary.
Thank you, David. We have actually cleaned out our kitchens, so the coffee machines have been put away. There are sachets. You can only get a coffee if you take your own cup. So the crockery, the cutlery, the coffee machines, the toasters have all been taken away. You can put your lunch in the fridge, but where you sit, there's signage everywhere that says you're absolutely limited to 4 people, where, you know, before there might have been 8 at a table. So that's how Melbourne Water has dealt with it, by just clearing the kitchens out. The problem that we're facing now is managing people's expectations, because they want to gallop back to the office. We're saying, no, if you can stay at home, work from home, and you have to book, you have to actually book a desk.
Yep, that makes a lot of sense.
And we use a very simple app to book the desks. It's called Condeco. So it's a very easy app to use. But
do you want to spell that, Mary?
It's CONDECO. And it's been configured specially for us. We've got approximately 500 people in the office at any one time. But the expectation, I mean, and I'm interested, so that's how we dealt with the kitchen situation. What we're having to deal with now is the expectations that people think we're going to return to normal. But we can't see that. Is anybody else facing those sorts of expectations?
Mary, I think you've brought up some really valid points. Certainly where I am at LinkSafe, we have followed the 25% rule. Well, it's not so much 25% rule, but I'm in on certain days. So, you know, so 25, and they do a rotating roster that way. So I'm in on a Tuesday and Wednesday. My colleagues in on a Monday and a Thursday. We don't share the same desks, and we're lucky here at LinkSafe that we are quite spread out. So we are very fortunate in that way, and we have to clean up our own space. No one's using the kitchen, so if they're having a coffee, luckily we've got a coffee, you know, place next door, and we're able to utilize that. So we're making do, and I know it's quite tempting to have a lot more people back in the office, and certainly our director and general manager are desperate to have people back. There's a bit more life in the office. There's certainly it's certainly very tempting, but we do have to be very, very careful, and we don't want to go straight back to normal and have issues. So yeah, you've certainly brought up some other valid points. Anyone else having certain you know, similar things happening at the offices?
I suppose it's Cameron here, our biggest issue, even getting a 25% back, which is 16 people, is the fact that we have a lot of people coming from who need to catch public transport to and from work. Now, that's a risk to our business as well as a risk to their health and safety. And sort of we're holding off bringing anyone back who's on public transport. We're currently, the 10 that are in are all parking within the building. So that's going to be a problem we'll have to overcome at some stage, because at some stage we will go back, even at 50%. You know, we've got a dozen or so car parking spots, so we're going to have to, I suppose, relinquish and do as best we can come the 11th of Jan, when that was sort of, we'd set that day before the government set the day, saying that we'll try a soft return then. But 50% is going to mean we've probably got about 20 odd people who will be catching public transport in. So we'll probably have to cross that bridge of what we do over the next couple of weeks, because otherwise people will be on holidays, and then what do we do? But I think we'll be, as David said, 50% of our workforce probably won't come back. I'd say we've got a lot of people very nervous, not keen on sitting on public transport for an hour and a half or whatever, if they're coming from Geelong. And yeah, that'll be interesting times.
And I think it's what makes also the perception of risk. So there are some people who are saying, I am not coming in because I do not want to get this virus, to others who are saying, look, it's kind of like the flu. You don't need to worry. And that's what makes our job, I think, so difficult.
Yeah, we sort of did a a risk assessment based on government guidelines and looked at, I suppose, high risk people, you know, above 70 years of age who may have had some health issues, and above 65 who had health issues. And we sort of categorised those people, which out of 60 odd in our office, there might be about 8 that probably fit into that category. So we're sort of thinking they will be probably the last ones to come back, except for one of the directors who fits that, and he's belligerent. He's coming back whenever he wants. So he owns the business, so really he can suffer. But we've done that, so we've sort of got a bit of an idea who we can and can't. And then we sort of put PT next to their name if they were catching public transport. So I gather, I suppose, our first port of call will be the people who drive in or walk in or run in or ride a bike in. And then we'll look at people with public transport after that. And then I suppose, you know, give it 2 or 3 months into the new year, we might look at probably the people that have got some issues in returning. If at all they do return, I think probably some of them might.
One of the things that I'd be interested in your reflections, some of the organisations I've been involved with, particularly government departments, that have a lot of people in regional Victoria and even rural and remote locations. I think it's to Mary's point that their perception of risk is very different to those that are in the middle of Melbourne. And they can't see the problem. You know, why can't they just continue to do what they've always done? They've never had a case of COVID in their part of the state. They're on their tractor or they're on their own a lot. And so there's a bit of a pushback when the policy comes out to say that when you're driving a government car, you need to wear a mask. And they're saying, what's the point? Whenever you're doing field work, you have to wear a mask. Maybe the more relaxing that Dan Andrews said recently might challenge some of that. But I think whereabouts on the spectrum of risk control do you place the policy, realising that there are some cohorts of the workforce that will push back hard against that because they just don't see the risk. I don't know whether any of you found that. I know, Mary, you're saying they're champing at the bit to come back to the office, but do you have offices in regional Victoria, and are they of similar ilk?
We've got 19 offices around, around sort of metropolitan Melbourne. The biggest issue that we've got are our waterways and land people who have been told that they need to socially distance. So they usually worked in crews of 4 and really wanted to get together and travel as a crew. Now they've been allowed to go back as 2 people in the car, but they're not, they have to wear a mask in the car. They're by themselves, that's all right. Yeah, they don't need to wear a mask in the car, but everybody's been pretty good. You know, on the issue though, Cameron, of showers and people cycling in and walking in, we're now supplying towels. So we said to everybody, no, we're getting ready. We cleaned our bike storage area because there's showers down there, and there's also a system where only 5 people can use it at any one time. You know, you can't just go in there. There's you take a ticket like you do at the supermarket. And also now towels are being washed. Very PwC for a government organisation.
One of the things that I might just jump in and say, at Melbourne University, where we've got, obviously thousands and thousands of staff and people engaged in really important research and teaching. So all of those areas have sort of, started to go back first as a priority. But one of the things that I've sort of found that we can't be complacent about the biggest hazard that we have in Australia, which is the musculoskeletal risk. They don't sort of take a holiday because we're very COVID centric. And I've seen at the university where, it's a huge organisation, and often, one hand doesn't know what the other hand's doing. But there's been some development of things like perspex screens, and haven't necessarily considered the anthropometrics around that, and fitted to. We have a lot of spaces, I suppose, where staff are assisting students. The students come and sit next to the staff at a workstation, and a perspex frame or screen shield has been placed in the middle of the workstation as a barrier, which presents a lot of issues for not only have they not considered the anthropometrics, so that when they're standing, it's still below nose height for a big percentage of the population, but also things like the screen's distorted, trying to look through, and the acoustics haven't been considered. So I think, there's lots of examples I could cite, and we haven't even talked really about psychosocial stuff, but I think, just be mindful that those hazards don't take a back seat necessarily just because COVID's here too. So just something to consider, keep in mind, designing things.
I agree with you, Rosie, and we've been doing a review of a retail chain recently that have put up these perspex screens on their counters. And what they found is the majority of the transactions between the cashier and the customer is around the side of the screen.
Yes.
They can't see, they can't. And, what's the purpose of it? And I think...
that's right. And look, I won't even go into all the guidance we've had to put out around Zoom and virtual conferencing, because the academics have had so much trouble with managing that with students, and there's this heightened attention, I think, with Zoom, where you lean in and you can't see, you can't hear. So there's a lot of stuff around that we've been working on.
So Rosie, can I just ask you a question? You mentioned about musculoskeletal. I know you're a leader in that space. But have you found been more or less incidents of people working from home compared to coming to the university?
Yeah, Elise is also here, and Elise is an OT who's currently progressing through her Masters in Ergonomics, and she at the uni sees most of the individual staff where it's beyond the outside the generalist OHS skill base. So Elise, you've had a great increase in requests for assessment, musculoskeletal assessments. Are you still there?
I am sorry about that. Yes, I would say that we've probably had a fourfold increase in referrals since March, and that has particularly spiked in after the first and second lockdowns. I would say that the majority of referrals have been around requests for things like sit-stand desks, where the nature of their role has increased substantially in terms of the sedentary static postures. So we've seen a lot of lower back issues, and particularly sort of neck and shoulders, because people are being sort of set up at dining room tables with big thick wooden beams underneath their tables, therefore they can't get to the right to an optimal position. So so there has been a marked increase, yes, in MSDs since working from home.
So it'll be interesting, Elise, in 2021 to see whether that trend continues, if the hybrid model becomes the norm of working some at home and some at the workplace. So maybe Marina, next year we might sort of pick this up somewhere along the way of what are the sustained impacts and what were short-term glitches that people have. But in terms of the psychosocial, I totally agree with you, Rosie. I think we're yet to see the long-term impacts that might have on people. I was speaking, was at a factory earlier this morning with a team, and they had a group of workers come back last week, and she said there was one woman in the group who was visibly shaking. She was so anxious. She didn't. She was told she needed to come back, and she didn't want to come back. And she said by about day 3 she started to settle down, but this was a factory worker. It wasn't an office type workplace. But that same workplace had 9 COVID positive cases earlier in the year. So she knew that was the place she was going back to. She personally hadn't, but I think that the long-term impacts of this is something we'll need to think about. But I'm just conscious of the time. Our hour is just coming up. So I'll hand back to you, Adrian or Marina. Where do we go next?
Over to you, Adrian.
Yeah, no worries. Well, thank you so much, David, for the presentation. Once again, it was excellent, and glad that we were able to get some, obviously, some interaction with some people on the call as well. So, look, we'll wrap up now, but I do have just a couple of points. So I'm just having a look here. There will be a recording that has been made and will be available to financial members on the website. So stay tuned for that. And also there'll be some further information about next year's dates, and the program will be sent out in January. So look, that's it from CSG. Merry Christmas to everybody that's on the call, and hopefully, fingers crossed, 2021 will look like a bit more of a normal year for everybody. So wishing everybody the very best. Ollie, any final words from yourself?
No, just again, to thanks to everyone for joining in our Zoom meeting today. Many thanks to David. David and I go back a long way. Actually, David was one of my professors when I was doing my my degree, so we go back a very long way. But again, thanks to Marina and the rest of the committee that's been organising the Zoom meetings. And as Adrian said, hopefully next year we're bigger and brighter and we can meet in person rather than on the Zooms. But the Zoom is the only medium that we can use at the moment. And again, thanks to everyone for joining. And on behalf of the committee, I'd like to wish everyone all the best for the festive season.